So I'm Lisa Kraft. I'm the Director of Clinical Operations for Bath Community Hospital, also with Bath Community Physicians Group, which is 4 rural health clinics. I was asked to speak today because I have completed the Certified Rural Health Clinic Professionals course. Has anyone here had that? Then you know it's a wonderful class. A little bit about my background and why I would highly recommend this course to anyone in your organization. I'm an RN. I've been a nurse for about 25 years. All of my experience is in a hospital. Level 1 trauma center, emergency department, flight nurse, lots of experience in critical care, ICUs, OR, infection control, 0 for an RHC. When I was given my position back in the fall of 2020, I was more than ready. It's over everything clinical in the hospital. So I was good with ICU, OR, ER, employee health, infection control. I could just go on. And then they said, there's 4 clinics. My first thought was, okay, it's a doctor's office. That's fine. I have 4 doctor's offices. But once I started, I had no clue what I was doing. Didn't understand the verbiage, didn't understand what they were talking about, didn't understand what a visit was. As far as I was concerned, the patient called and scheduled an appointment. It's a visit. So it was one of the situations where the staff really knew more than I did. Yet I'm being asked to be over these areas, and I can't even talk the language. I didn't understand the finances. I didn't understand the compliance piece. And then I started doing some research and looking online and trying to come up with ways to understand exactly what an RHC actually was. Got in contact with Sherry, and she recommended the class and gave me the information I needed to sign up. It's a very simple class. It takes about 6 weeks. Do it on your own time. It really didn't interfere with my regular job at all. Self-paced. And I had all these questions and all these different things that I really didn't understand when it came to being over these clinics and trying to interact with both our patients and our employees. And this class actually put the pieces together for me. It gave me the basic information that I needed to be able to talk logically, intelligently about an RHC and all the guidelines and the finance and just the different pieces about the whole thing. To the degree that I'm actually recommending this class and requiring all of my clinic managers and team leads to take this class. I feel that it is something that is going to enhance our patient experience. And it's going to also help with buy-in from our employees as to why we do what we do and to understand why we do what we do. Some of our clinics are in some really, really out-of-the-way areas. I'll just give you an example. One of our clinics is so rural that we have to piggyback our internet off of the local elementary school. So that'll give you an idea. I have another RHC that we weren't able to turn on our patient portal because the internet didn't work well enough in that area. So our patient couldn't do a self-check-in from the parking lot. So we've got some challenges for the health clinics that I work with. And some of our challenges, it's a very rural, small, declining area in population. And this class enabled me to have the knowledge I needed to face the challenges of what we're looking at in those communities. And I just wanted to basically just say that if you haven't had this class, please take an opportunity to take it. It will definitely enhance your ability to run your clinics. It will help you in bringing on new employees to train them. And there's still a lot I don't know. But it did give me that basic ability to be able to have the conversations I need to have so that I understand now the services that we're providing to our communities. So that's really just very simple, but I just wanted to let everyone know that I think that if you have the opportunity for your clinics to receive this education, please take the opportunity. Yes?
Well, I'll add that Virginia Rural Health Association with the grant will pay for the registration because it is like $475.25. And for one person at each facility until we see the desire to attend, and then we'll go from there. But you do have to take an introduction to RHC's webinar first, and that's free. And there's a link on the VRHA website. And then to sign up for the course, the registration won't begin till August, and that there's an open window that you do the course in the 6 weeks or however time, and then you'll take a test sometime in October, and that will be your certification.
And it is a proctored test, so if you were to give it to any of your employees, don't let them think that they can wait until the week of the test and say, I'm going to cram and study this. They will not pass the test. It's not a, I'm just going to read over this and take this. It truly does take the whole 6 weeks. It gives you the opportunity to see it both on a video and to present and to print a PowerPoint, which you can then use that as a study guide. And you will need that as a study guide because it's very involved, particularly when you start getting to the finance piece and the cost reporting. But again, I have been able to take those study guides and I've put them in a binder and I'll refer back to them because there's so much information there that it's just a great resource. Mm-hmm.
Put together a binder. Can you take that binder in your testing zone?
No.
Okay.
It is a proctored test. No. You log into a different. No. You log into another. You log in. Yeah. You log into another portal. They tell you to clear your desk, and then you log into the portal, and you're being watched while you take a proctored test. So you really do need to take that 6 weeks and study. But again, it's a lot of information, but you will find it very beneficial going forward. And I think your clinics will benefit from it.
So quick question. On your VRHA website, at the home page, you go to the bottom left and click on the Rural Health Clinics. And there, about a quarter of the way down, is all of your educational opportunities.
Should be. Yes, it should be.
Yeah, I'm looking at
it. It is.
So what I'm looking at is, and you have the links, all of those, and you're basically showing that you have the billing and coding workshops. Is that what we just went through, or was this just a taste of that?
No.
Let me just say, this is a special course, it's on its own CRHCP.
It's right,
And it's
right
not
under.
just, what she added, it's HR, it's the finance, it's cost reports, it's billing and coding, it's compliance.
Federal
I
regulations.
did that piece.
Yes,
And
Okay.
federal
it's,
regulations.
so a funny story about that, if I have a minute, because, so the first year, I was a monitor, Angie was a monitor in the room, because we did it on site, in a room, you know, with people, so obviously that was well monitored, because we're looking at you. And I said, oh, I'm gonna just take it while I'm sitting here. So the people from the staff came up to me afterwards and said, can we talk to you for a minute? Sure. You failed. Well, I said, please tell me I didn't fail a compliance piece, and I didn't. I failed cost report, things I don't, we have Patty for that, and other people, you know, but it's really involved. Say it again. What is it? Oh, thank goodness. Not compliance. It's really a great resource. And the fact that you're gonna get, pardon me?
You don't have to take it on site?
No,
No,
you take it online,
no, you take
but
it
you must
online.
appear within the next
Yes.
year for, you must come to a meeting kind of thing, which has been really a challenge through COVID, but we're back, so. it'll be
And
fun.
all of the presenters today have touched on pieces that I have obtained information about from this course. From quality to cost to billing to how to charge a visit, HR, what constitutes a visit, what are the regulations needed for your RHC as far as emergency management. There's a huge section on that, and how often do you need to do your roundtables, and how often do you need to have a live event, and it encompasses everything.
Is this like a 2-month-long course?
6 weeks. It's about self-study, but on average, about 6 weeks to prepare you for the test.
The coding and billing workshops actually are through Arch Pro Coding. And that is a totally different
Section.
It's for a coder to get certified.
Okay.
A coder or a biller to be certified in ICT coding.
And can I make a suggestion? If you're looking at the certification course, and this is just FYI, because it is intense. There's a lot to learn, and you came from hospital, I came from
Yes.
hospital before clinics. The person taking it, you really need probably a good year under your belt before you study. But then print it out, create that binder, and then if you have multiple clinics and newbies, I really would suggest having them read through some of that stuff and get the feel for what it's all about. It's a great training tool for new staff as well. Absolutely.
And again, when I first started, as she said, and I mentioned earlier, 25 years of hospital. I mean, I knew nothing about a rural health clinic, nothing at all. I mean, as far as I was concerned, it was a doctor's office. I had no idea that there were specific rules and regulations just to that group of clinics. And, I had this huge list of questions, and I couldn't figure out where to get my answers. But this course, over this 6 weeks period, it allowed me to answer those questions. I may not have gotten quite as in-depth, for instance, with the billing piece that I would like to get to, but it gave me just enough of it to where I could talk logically and understand what we were doing, which is why I would recommend it for anybody in your clinics or anybody who does any type of oversight in any of your clinics. So that's it. Any other questions?
You have to be recertified every 2 years.
2 years.
And you have, what the criteria for that is?
You need to attend a conference, and you need to do so many of the hours, CE hours, but I can't, TE, yes. But I can't remember the number of hours. But
And it opens in August, so we're
Yes.
doing re-reports this month, I have to do mine. So the registration starts in August again.
They're actually on the website, the
It's the
CEUs.
same
You can just click on them, and some of them are videos,
No.
most of them are just
But you
slides.
get your certification, your first year, you don't have to do anything.
no, it's every other. So if you get your certification on an even year, then you're going to recertify on the next even. It's every other. You're good for the first 12 months. It is very much well worth it because it has, like I said, it's allowed me to have that knowledge that I didn't have. So, all right. Well, thank you.